A very good morning, good afternoon, good evening to you all, my viewers, my listeners that have already subscribed into my YouTube channel. I welcome you today to yet another episode. I know this is an episode that has been confusing so many people. You don't know why you tend to urinate oftenly. I have come to discuss the different reasons why you may have to go to the loo or to go and pee oftenly. Now, most of the times why we go to the toilet or why we go to the loo, we have so many reasons, but they are all running around our kidneys today. Just like you can see the screen behind me, I'm going to basically be talking about the kidneys because they are the ones that are responsible in our system of micturition. First things first, our first point, we are going to talk about environment. You know, most of the times when we are in winter, people tend to urinate more oftenly than when it is summer. Do you know why? In winter is the only way the body can lose heat, is the only way the body can lose fluids. Therefore, you're going to be urinating more oftenly because when it is winter, you can't sweat. So the only way the body can lose that sweat, the body can lose that heat, the body can lose that excess water is you going to the toilet. So weather or environment can make you go to the loo more oftenly. My second point I'd like to talk about is diabetes mellitus. Now, diabetes mellitus is a blood sugar disorder in the body, and it's mainly in two types. We have type 1 and type 2. Type 1, it's juvenile, whereas type 2 is lifestyle. Your lifestyle causes you have type 2. How comes that a person with diabetes mellitus often go to the loo? It's very simple. The sugar or glucose runs into your kidneys and goes into the distal convoluted tubule, and wherever there is glucose, there is water. So you're going to be urinating more, and when glucose goes into your convoluted tubule, into your collecting duct, you go to the loo and urinate, you're going to remain thirsty, and as a result you're going to be drinking more water, and the more water you drink, the more you're going to be going to the loo to pee. The next point I'll talk about is small bladder. Just like we have small people, medium and big, also some people have small bladders and they don't know. So you tend that the more amount that goes into your bladder, whether it is little or it's medium, you have to go to the loo because your bladder cannot accommodate some amounts of urine. Some little amounts that goes there, you have to go to the toilet and make susu. Why? Because your bladder is small. So I would urge you that if you have such a problem of going to the toilet more oftenly, please don't sit down, go and see a urologist. My friend, you have a problem with a small bladder. Okay, our next point is drinking a lot of water. Now, someone will say, they tell us to drink water is healthy, water is life. Now you're telling us when we drink more water, we are going to go to the toilet, or we are going to be peeing most of our times. Yes, the more you pee, the more the kidneys are cleansing themselves, because water helps the kidneys to wash away the wastes from the body. So if you're not taking enough water, it means the kidneys will not wash away the wastes out of the body. They will be just being kept into your kidneys, in the pelvis of the kidney, and as a result, you begin getting infections. So the more you go to the toilet and make you pee because you're drinking enough water, it means your kidneys are cleansing themselves, they are cleaning themselves. And then next to that point of drinking more water is dehydration. If you're not drinking enough water, you can also go to the toilet more often. Do you know why? Concentrated urine tends to irritate your bladder, so as a result, you're going to be going to the toilet more oftenly. My next point is urinary tract infections. Now, urinary tract infections are mainly caused by bacteria. So in so doing, they're going to cause you go to the toilet more oftenly to make susu. So therefore, if you tend to urinate more oftenly and you're having pain on urination, anyway, some of the signs and symptoms of urinary tract infections that will make you run to the hospital to see a doctor to find out whether it is a UTI is you're going to be urinating when you're having pain. So once you begin urinating, having pain, or micturating with pain, go and see a doctor. You could be having a UTI, and this is why you are urinating more oftenly. My next point is weak pelvic floor muscles. Now this one is brought about by so many issues. For example, childbirth, a woman who has just given birth, the pelvic muscles could be weak. People who have chronic constipation, the pelvic muscles could be weak, and therefore bladder being part of the organs that are in the pelvis, it becomes weaker to contain the amount of urine, and therefore weak pelvic floor muscles will not assist your bladder to keep more urine in it. Therefore you'll be going to the loo to make to pee. Our next point is medications. Now medications mainly I'll center around medications that we give to our patients of hypertension, and the point in case here we'll talk about diuretics. Now diuretics examples are furosemide. You who is hypertensive, you know what I'm talking about. Furosemide makes you to go to that loo more oftenly, and we give it to you in order to lose more water in the body that you see going into your extremities. You find your hands are swelling, your legs are swelling, which we call the upper and the lower extremities. So we give you diuretics to help you excrete the excessive fluids from your body. So if your doctor did tell you, I have given you that clue that you were given furosemide in order to excrete the excess fluids from your body. My point next I would like to talk about is pregnancy. And now the uterus, where the baby grows from, and the bladder are symmetrically near each other. It means when a woman is pregnant, or when a mother is pregnant, the pregnant uterus tends to suppress the bladder, and as a result the little amount of urine that goes into your bladder will be irritating you to go and urinate it out. Why? It's because the baby in the uterus is suppressing. In fact, it's not a baby. When the baby is still in utero, we call it a fetus. So the fetus in your utero or in your uterus is going to be suppressing your bladder, and as a result you'll be going to the loo more oftenly. Now my next point I would like to talk about, and possibly my last point, is overreactive bladder. Some people's bladder are so overreactive, something simple irritates it and someone wants to go to the toilet and susu. Thank you so much for listening to me today. It remains me, your friend Royal Mark. You can always follow me on my YouTube channel. Subscribe if you haven't subscribed. Go to my TikTok, go to my Twitter. I still use the same names. Facebook, I use the same names. Follow me. I will also subscribe to yours if you subscribe on my YouTube channel. Otherwise, just know so many things are still coming. Today, we were talking about reasons as to why you oftenly go and pee. Next is another episode that will be so much important for you to listen to. So if you haven't subscribed, do the needful. I love you and God bless you.